Hi everyone, welcome back. I hope you've enjoyed the session so far. It is my great pleasure to introduce our next session, Dr. Henrik Matthies, and he will be giving us the German example of adoption of health tech innovation. Henrik, it's wonderful to have you here, and over to you.
Thank you very much for having me. It's my pleasure to have the next 15 to 20 minutes where I want to outline to you how Germany, good old Germany, somehow managed to get ahead in terms of digital health, although we have not been really the champion of digitization so far. Let me start by explaining who I am or who I am representing. The German Ministry of Health has established the so-called Health Innovation Hub just 2.5 years ago. I am managing director of this Health Innovation Hub. We are a think tank sparring partner to the ministry, but also to all other national healthcare stakeholders in Germany. And we very much translate, and that is what I'm trying to do at least today, to give you guys an understanding of what's going on the regulatory side, but also on the market side in Germany. And we do this translation for all kinds of stakeholders, to physician healthcare professionals, industry, but also the startup world and many others. We are doing this because we want to have the best possible healthcare system of the world for our patients in Germany. And what we are doing here with the HIH is only temporary. We will dissolve already end of this year. We're a team of 12 experts. Our chairman, Professor Jörg Debatin, was the CTO of GE Healthcare worldwide before. In my team, I also have pharmacists, medical lawyers, data scientists, hospital managers, so really a broad variety of expertise to make sure that we are the neutral but competent think tank for the ministry and everyone else. We deal very much with all topics that somehow concern digitization in healthcare at the moment. That's quite broad, but I want to give you some highlights today about first the so-called DIGA fast track, the digital health application fast track, about the electronic patient record and the e-prescription initiatives that are going on in Germany. So let me first start by highlighting how the German healthcare system very much looked like in 2018 before the guy you just saw, the current Minister of Health, Jens Spahn, and the entire government took office. This is very much not marketing, but this is how still, especially in the hospital world, the German healthcare system works. It's very much paper-based. But the good news is this is changing at a very rapid speed, especially in ambulatory care, which is very big in Germany, but also in hospital care and in all other fields of healthcare anyways. In 2018, we were very much at the bottom of any chart. If you looked at how digital is your healthcare system, you see Estonia, Canada, Denmark on the top. And I don't want to argue that already 3 years later, we are there on top, but at least we have made some ground and are probably somewhere around the English system by now. One very important and not to underestimate factor is the exogenous shock we had with Corona. If you look at the chart beginning of last year, how many physicians were actively using telemedicine, it's a joke. We have more than 250,000 physicians in Germany. So basically no one was using that technology, but only 6 months later, and that is only true to Corona and the regulation that took place a bit before that made it possible, we now have a vast majority of physicians using technologies like telemedicine, and this is very much true for any other digital health aspect of healthcare. A second exclamation mark is the Corona Warning app. We were about the last country to actually have this one in place. It took us ages, but we had a very broad societal dialogue that made it possible that by now 25 million or even more than 25 million of our 80 million Germans are actively using it. More than 7 million lab results have been transferred. So the entire lab industry has by now interfaces to this central warning app, and hundreds of thousands of infections have been registered. So this is to show you that despite the German Datenschutzangst, so our angst against all kinds of data protection topics, is here not really much playing out, but instead people understood this is necessary. This is the first big national digital health action that is really working, and this is a promising sign. And there's a bit hype at the moment. This is just from December, an article outlining that Germany has somehow changed, but don't believe the hype. I'm one of the co-author of this paper, but nevertheless, I want to show you in the next 10 minutes what really happened in this country. So most importantly, DIGA Fast Track, that is probably what many of you have already heard. I want to explain in short how it works, how you can qualify for it, and where we are in terms of implementation as of now. Many of you may know, but at least for me, it was a kind of unknown, how much money is spent in the German statutory health insurance system, the so-called GKV. More than 90% of all Germans are insured in the statutory healthcare system, and they spend 240 billion euros per year. So a massive chunk. It's the largest integrated healthcare market in the world. Of course, the US market is larger, but it's very much segmented into HMOs. The Chinese-Indian market is larger in terms of population, but they don't spend so much. So this is the largest integrated healthcare market that we have. And if you change regulation in this GKV market, for once, it is working for all of the 73 million people. So any change really has an impact. And for very long, any sort of digital innovation had really no chance to get into the system until the so-called DIGA Fast Track. You don't need to read all this, but we have endless ways. It's a very complex system, the GKV. But none of them fitted digital innovations. So it was very difficult to get any kind of digital innovation into the system. This has changed with the so-called DVG, Digital Healthcare Act, and at core, the definition of a DIGA, a digital health application. What do you have to be to or qualify to be a DIGA as approved by BfArM? First, your digital health application needs to be a CE certified product, either classes 1 up to 2A. So low risk products that are certified by TÜV Süd or similar auditory bodies. You have to focus very much on the patient. So any digital health application, which is more a decision support system for physicians or HCPs, doesn't qualify. You have to center your features, your functionality around the patient. You can include treating doctors and HCPs, but the center has to be on the patient. The main function has to be digital. So yes, if your DIGA has some hardware components that may qualify, but the very core of your DIGA has to be software. And last but not least, it's a long list of functionalities. Basically, it's more important what's not in there. So prevention is excluded, and contraception and a few other minor topics, but the functionality list is very extensive. If you fulfill those 4 criteria, then you have good chances to get approved by BfArM. That is the German FDA equivalent. There's a long list of requirements which you need to fulfill. I don't want to go into great details here. Nothing of that is super surprising. Many of them are anyways part of the CE marking. What's more important is here to the right-hand side, you need to have scientific proof and evidence that you either have a medical benefit that is very much known to the industry, you know, the evidence-based medicine schemes, if you fulfill in there. But what's new is that you may also just have to prove that you have structural and procedural effects. And we will go into this now in detail because it's completely new for Germany and probably for many other systems. structural and procedural effects here on the left-hand side are all those effects centered around the patient, which very much deal with his or her everyday life. How does a DIGA impact the everyday life of a patient apart from the medical side? Any of those effects can be measured and can help you to get approval for your DIGA. So if you look again on the left-hand side, this opens up a whole new scientific approach, a lot of new data pools, not only real-world evidence, but really data pools from epidemiology, behavioral research, data science, and much more, than just the very much known medical benefit triage of our pyramid around RCTs and similar approaches. So that's exciting, that's new, and that will hopefully help us to better understand how really to improve a patient's situation, not just focusing on the medical benefit alone. I mentioned the BfArM, the Bundesinstitut für Arzneimittel und Medizinprodukte. It's the German FDA equivalent. They have a public list where you can see all the DIGAs that have been approved, 10 by now. Left-hand side is the URL if you want to go into greater details. So far only in German, but it will be in English soon. Let us look a bit at what different use cases can be envisioned for DIGA, and they are quite broad. It ranges from rehabilitation over monitoring and diagnosis, so very much close to therapy, to topics like guidance. If you have a chronic disease, it's not a one-timer that a DIGA can help you, but it can help you throughout your next 20, 30, 40 years. Support DIGAs are very similar to the guidance ones. If you have a chronic disease, which is complex, where you need to go through various stages, this support DIGA can help you throughout those stages. And DIGA can go as far as therapy. You always have to bear in mind that you have to remain within the low risk classes 1 to 2A. If you want to read more about the DIGA Fast Track, I very much recommend you the English-speaking BfArM DIGA guide. It's for free as a PDF, and it's very much written for manufacturers of DIGA, so no legal regulatory complex language and in English. And me and my team have written a handbook for DIGA manufacturers as well, which is a bit more comprehensive. It starts when you want to start a digital health company in Germany, and it ranges until you have your pricing negotiations. So if you want to go have the entire view, then I would recommend you this book. It will be out in English probably in summer this year, maybe even earlier. Now, this was a lot about the DIGA Fast Track, but I want to highlight 2 more topics which are quite important because they are even more basic in how we currently digitize our system. The DIGA Fast Track is an opener for any type of innovation into the system, but the system as such is not very much changed by that immediately. Yet, the electronic patient record, in short in German EPA, is the very much needed infrastructure. So we do not have any EHRs or similar so far. We did not even have any safe, secure infrastructure to exchange data between various HCPs, pharmacies, hospitals, and so on. But this is finally done. It took us about 15 years. But now that we have this infrastructure, it's kind of secure intranet just for healthcare in Germany. We can run all those use cases finally, and that is very much exciting for anyone, not just e-prescription, what I will come to in a second, and DIGA, but basically we now can easily generate exchange prompts. We can talk about research data. We can look at integrated healthcare solutions, not just the specific individual actions, and much more. And any German has a right to get an EPA since 20 days, so since early January. And again, surprisingly, Germans are not so afraid to set up their own EPA. This is a survey from last year, and we were also quite surprised. We would have expected less than a third probably being in favor, but this time has changed. Many understand why it's necessary to have all relevant documents at one point accessible for healthcare professionals. it's a bit complex how the electronic health record or the EPA in Germany works specifically. Maybe highlighting 2 points. First, it's patient-led. So the patient decides if this document is set up at all and what documents will be in there and who will have access to his record. And second, the health insurance has to provide the entire infrastructure, the entire EPA system for their insured members. And it's all interoperable. We are now following HL7 standards and similar. So finally, also this part is taken care of in Germany. Last but not least, we will also have on top of this just explained infrastructure an e-prescription solution, probably in summer, autumn this year. Some pilots are already out, but this will again change very dramatically how healthcare data is shared within the healthcare professionals. Just think about e-medication and other topics. So we're very much looking forward to this chapter as well. To summarize in a few words, why are we so keen doing this? Why have I quit my job? I was building startups before, and the rest of my team to make sure that this transformation, this digital transformation in Germany works. We are a bit cautious what's happening around us, and we know that our system as of now is not competitive at all to large tech offerings. So we want to make sure that our system, not just in Germany, but overall in Europe, is competitive enough that we define the rules, how data is shared and used. And we think and very much believe that the individual should do so. It should not be neither the state, like in China, not the market like we have it in the States. We want to have the individual, the citizen, decide what's happening with his or her data to the benefit of his health and the health of the entire society. So in very brief, this was just an overview. If you have an urge to get more information, we have an English-speaking website. Our LinkedIn account is all English, Twitter some of the times. You can also reach out to me individually. And I want to thank you very much for your interest in what's going on in Germany. And I wish you good health. COVID will unfortunately bother us at least for more a month until vaccination is out. So stay safe, stay healthy, and see you soon.
Thank you so much, Henrik. That was really informative. And as he says, please do reach out if you have any questions. We are obviously all for, everyone connecting and forming new connections, even if we are running the event virtually this year. I do hope you can join us at 4 o'clock for our panel, The Next Generation of Hospitalization. But until then, look after yourselves, and I will see you soon.